today we will talk about examination of a lump. So as you see, here we can see, yes, this is just a demonstration, but we can see a lump over the dorsal aspect of the right hand. So when you are examining for a lump, you can ask few specific questions if necessary, and at the same time it's better to see whether there are any other multiple lumps anywhere in the body, and also compare with the other hand. Okay, right. So regarding a lump, so it's better to mention about the side and the side. So this is on the right hand, the dorsal aspect. There's a lump, and so on inspection, this is about 2 centimeters by 2 centimeters in diameter, and lying over the dorsal aspect of the hand. So you can observe for a visible pulsations if there is any so pulsatility, which gives a clue about the possibility of a vascular lump, and also any sort of evidence of any infection like redness also in inspection, and also any discoloration. So with regards to the palpation, so you can palpate the lump about the consistency. So it may be firm or hard lump. Hard is like a bone, firm is like your nose, or it may be firm to hard in between. And also the surface, whether it is smooth surface or irregular, and also the edges, whether it is regular edge or irregular edge. The next most important thing is the tissue plane. When you say tissue plane, the attachment to the skin and to the deeper structures both. Skin attachment you can check in 3 ways. One is you are pinching over the lump, then you see the lump is attached to the skin. Then number 2 is you can move the skin over the lump, then you can feel that the skin is moving separately. Third method is you move like that in 2 directions, either this direction or this direction. Then you can see that skin is freely moving against the lump. Regarding the deep attachments, so you can hold the lump and you can mobile on both directions and see whether it is mobile. So that means it is not attached to the bone. Next thing is to check the next deep attachment is the tendons and the muscles. So for that you have to examine while the muscles are tensed as well as in relaxed position. So ideally speaking, you have to do 4 movements. One is on the relaxed position, you hold the lump and move it in the vertical direction. Then you ask the patient to tense the underlying muscles. For that you should know what the underlying muscles are. Then only you can ask the patient to do the relevant respective movement. Can you extend the fingers against my resistance? Yeah. So like that you check the same direction, vertical direction, like you check in the relaxed position. Okay, relax now. Then you do the transverse position. On the relaxed position, you move the lump and see. Then again you ask the patient to tense the underlying tendons and the muscles. Can you extend the fingers again against my resistance? Do the same movement, transverse direction, and see. So 4 movements: vertical, relaxed, and vertical when the muscles are tensed. Transverse when the muscles are relaxed, and transverse when the muscles are tensed. So all 4 movements are necessary for us to say whether there is any attachment to the underlying muscles and the tendons. So the next thing is about the composition. We can get an idea by doing the fluctuation. So if the lump is fluctuant, that means it is a cystic lump or it has fluid inside. So the way to do the fluctuation is, again you hold the lump with your thumb and the index finger of the non-dominant hand and stabilize the lump. Then with your index finger of the dominant hand you press in the middle, and if it is fluctuant you can feel with your non-dominant hand, the fingers, the thumb and the index finger will feel that movement. After that you do it in the perpendicular 90 degrees on the other side. Repeat the same thing. While holding with the non-dominant hand, you press with the index finger of the dominant hand. Then you will feel to these two fingers whether it is fluctuant or not. So that is a fluctuation. So if it is fluctuant, that means it has fluid. It is a cystic lump. So the next thing is transillumination. When the lump is fluctuant or cystic, we want to know whether it is clear fluid or not clear fluid. For that, the test is transillumination. For that, you need a torch. And at the same time, it's better to have something to cover the area. And you should shine the torch from one end, and you should be able to visualize covering the direct light. You need something to cover the direct light coming to this side. Switch it on, switch it off. So you have to compare. So again, you can do it in two sides as well. So that is transillumination. So if it is transilluminant, that means the fluctuant lump has clear fluid. So this is actually a classical site for us to get some sort of characteristic lump, which is a ganglion. So ganglions are known to be in the dorsal aspect of the hand. So that is the number one differential diagnosis if you get a lump in this particular area. So in a place like this, although the characteristic lump is the ganglion, we have to think about other possibilities like a vascular lump. So in case of a venous lump, if you press like that, you can see it is compressible. The lump is reducing in size when you take your hand out and refill again. And other possibility is a arterial lump. On inspection, it will be pulsatile. You can see the pulsations. And also with your palpations, you can see the feel the pulsatility, and it will be expansile. In all directions, you will feel that your hands are moving with the pulsations. And the other thing is, if it is a vascular lump, the auscultation. You can keep the stethoscope and you will hear a bruit. Another common lump you can get is a lipoma. So lipomas you can get anywhere in the body. You get fatty tissue. But commonly you can see lipomas like in the forearms or arms and the main trunk. So like any other lump, you have to do the proper examination. But some characteristic things about lipoma is it is a bit lobulated. You will get that lobulated feeling when you palpate. When you palpate, you can feel some lobules. That is characteristic for a lipoma. At the same time, it may be fluctuant and usually not transilluminant. And lipomas can be multiple as well. And at the same time, sometimes the painful lipomas you can get, which has a risk of very rarely becoming malignant as well. Another common lump you see in the body is a sebaceous cyst. So there are some characteristic features for a sebaceous cyst as well. So on inspection, most of the time you might see a punctum in the middle, like a black or bluish dot. And the number two feature is some bluish discoloration or a bluish tinge of the sebaceous cyst. That is also characteristic for a sebaceous cyst. Then on your palpation, that the tissue plane, the sebaceous cyst will be attached to the skin. When it comes to management, most of the lipomas and the sebaceous cyst we can excise under local anesthesia. Only the large, deeper ones which will need full anesthesia or the general anesthesia. One major difference is that when you are compared to a lipoma, when you are excising a sebaceous cyst, you are removing it under local anesthesia. After the local anesthesia, the incision you make for a sebaceous cyst is different, because you have to make an elliptical incision incorporating the punctum, not a linear incision, but an elliptical incision incorporating the punctum. Then only you can remove the whole sebaceous cyst with the punctum.